My name is Dr. Robert Rifkin, and I'm a medical oncologist in Denver, Colorado, and also serve as the disease lead for U.S. oncology research in multiple myeloma. As you can imagine, this is a changing landscape with multiple new drug approvals, but perhaps one of the things that sort of turned all of us upside down is the COVID epidemic. And when we designed this trial, the idea was to come up with a safe, effective, and non-toxic treatment for multiple myeloma using an all-oral regimen. And the idea would be to start with a traditional bortezomib-based induction, and then after 3 cycles, if you're responding, would be to switch to the all-oral combination using ixazomib, lenalidomide, and dexamethasone. So initially the trial was designed and still hopes to be what we would call an in-class transition. So you would start with bortezomib in the first series of 3 cycles, which, as all of you know, is a subcutaneously injected product, and then go to an oral proteasome inhibitor, ixazomib, which most of the listeners will know as Ninlaro. And so the idea really was to do something that would be effective and help with patient convenience. In addition, one of the other aspects of the trial, which has proved to be very interesting, is the use of actigraphy, where we actually monitor patients' activities for half of each monthly cycle. So we like to see if what you say you're doing is what you're really doing using our Garmin or Fitbit equivalent device. So it turns out to be a very exciting study because we're using the novel agent ixazomib. We're going to an all-oral regimen, and then we're going to be one of the first trials reading out the actigraphy utilizing a Fitbit device. And we also have a lot of quality of life instruments as well. So something quite unique in a study design. So in this case, we actually designed a trial with very wide open inclusion criteria. As all of you know, there are a lot of very large phase 3 clinical trials that have very specific inclusion and exclusion criteria. And we and others in multiple studies have shown that that's not really a reflection of the real world. So when you look at registry data, as we've done with the Insight registry and Connect registries, analysis show that approximately 40% of our registry patients, which are a real-world sample, might be eligible for clinical trials. But in fact, many of the patients are excluded because the trials are looking at very specific study populations. So we intentionally put this trial in the community setting, which is where the real world sort of rubber meets the road, if you will. And we know that these patients are very representative of what's out there. We made the inclusion criteria very wide open. So in this trial, all you have to have is a bortezomib-based induction. It could be a doublet or a triplet, but just 3 cycles of bortezomib. And then if you're stable or responding, you'd be eligible to switch to the all-oral regimen and hopefully not only continue to treat myeloma, but actually respond significantly. So we hope that as you switch with the in-class transition from one proteasome inhibitor to another, that your response will not only continue, but that it in fact will deepen. It turned out to be a very interesting trial because initially the uptake was extraordinarily slow because you had to find newly diagnosed myeloma patients that were transplant ineligible. So as all of you know, this myeloma is a disease of the elderly. And so this in the United States would be a Medicare population. And to date, what we're doing is taking some of the first looks at our data. So data will be presented at EHA, where we'll focus on the study design. And remember, this is a little bit different because now we're doing an in-class transition from a subcutaneous proteasome inhibitor to an oral proteasome inhibitor. So this will be a clinical trial that you really haven't seen very much. And we'll show evidence on the first probably approximately 60 to 90 patients The median age of the population is just what you'd expect. It's 73 or so. And we'll show you the distribution of the stages, and we'll show some response criteria. So we'll also importantly show toxicity, because as you know, if this is an all oral regimen and patients are only required to see their oncologist or myeloma treating physician once a month, we want to be really careful about what's going on in between cycles. And so we're collecting all of the data real time. And one of the things I think that we'll show is the actigraphy has really taken off. Patients are delighted to participate in their own care. They're delighted to report not only their side effects, which are very important, but also changes in their quality of life. And the interesting thing to me is that in this early trial of actigraphy, the compliance rate, meaning those supporting their data, reporting it regularly, is well in excess of 95%. So this is actually really exciting because patients now have become engaged in their own participation in a clinical trial. And it's much more than just asking the standard quality of life and standard questionnaires, but it's really giving patients a chance to play an active role. So you will see not only the activity data and the actigraphy data, so you'll see both, meaning the activity of the drug, the actigraphy, and then we're going to look at response rates, and we're going to show hopefully deepening of response over time and a favorable safety profile, because you can't do something like this if the all oral regimen, people are looking at it and going, you know, that's the most terrible thing I've ever taken, and I'm just not going to do it. So we really want to make it good. And then the patients actually, at the end of each cycle, bring in the Ninlaro dose pack, which has lots of colors and is fun to get tablets out of. But more importantly, we can see, you know, that they took the 3 doses once a week during each cycle and punched out their blister packs and did everything. In addition, they're turning in diaries and things like that. And we're going to show that quality of life is maintained, that compliance is excellent, and that responses are deepening. So although this is a preliminary analysis, I think certainly it paves the way for future clinical trials in the real world, where we're going to try to be inclusive rather than exclusive as required by some of the large phase 3 trials. I think overall, once the study took off, patients and investigators alike became very excited. Accrual is going nicely. And I think the fun part is this kind of a study is going to be opened in other parts of the world, including Europe and China. So we'll really get to see not only if the response rates, safety, and efficacy are duplicated, but how this plays in various cultures. So I think it's going to be a really exciting foundation for a lot of other interesting things coming down the road.